the participants from our respective SIP center. To start with, our today's guest speaker, Dr. Mukund Sabnis sir, is the founder director of Jeevan Rekha Analytical Services. He is also founder president of Jeevan Rekha Ayurvedic Chikitsalaya and Research Center, Aurangabad. He is having an MD Ayurveda in Shastra and Vaisheshika Kalpana. He has worked extensively in standardization and stability of Ayurvedic medicines. He has developed a unique management for obesity. More than 52,000 patients have been benefited with his treatment. Developed more than 85 centers in India and abroad for treating obesity as a disease. He is having a clinical experience. His area of specialization, working extensively in obesity and hyperlipidemic disorders, having wide experience in Ayurvedic drug formulation and drug development, working on standardization of Ayurvedic medicines with a team from facilities such as biochemistry, microbiology in the renowned labs. He has many associations, a member of many associations. Also, he has an awards to his credit, Dhanvantari Award, Ayurved Mitra Puraskar, recipient of Vaidya Puratkar Puraskar. He is a member of many bodies and subcommittees and advisory committees. He has more than 6 to 7 papers to his credit. He is authors of many books, including Chemistry and Pharmacology of Ayurvedic Medicinal Plants, Concept of Rasayan. Currently working as a consultant for the formulation and standardization of Ayurvedic pharmaceutical companies. Delivered more than 100 speeches and talks on Ayurveda on the various platforms, including All India Radio and television channels. So with this, I welcome you, sir, and handing you over for today's e-sessions. I hope students will benefit much and more into this particular topic that you have chosen for today's. So over to you, sir. Please carry forward.
Thank you very much, Rathod sir. And thank you very much to MUHS. They have given me a chance to share my views between all the SIP centers and students of MUHS all over Maharashtra. So today's topic of discussion is the metabolic syndrome, Ayurveda view, and how the modern science looks into it, and how Ayurveda proceeds into metabolic disorders, and how should be the vision looking and treating metabolic disorders. So looking into metabolic disorders, it is a approach, and whatever has been mentioned in Ayurveda regarding metabolic disorders or metabolic syndrome, which can be categorized as Santarpanjanya Vyadhi or anabolic disorders as per modern medicine. So there are a number of controversies. The basic pathologies are to be treated where they are not targeted actually. And these pathologies, if targeted, the things can be reversed very nicely. So looking into the pathophysiology of metabolic disorders, I have taken 2 disorders as an example. One will be obesity, in which I am dealing extensively from last 30 years at a molecular level. Another is diabetes, which is a very, very common disorder, and where we are moreover into anti-diabetics, maybe from Ayurveda part or maybe from modern part, where the disease process is not targeted actually. So treating diabetes and treating hyperglycemia is just treating an epitome, and a big pathology is under the water, which is not touched. Similarly, when it comes to obesity and other metabolic disorders, we only target weight reduction and the shrinking of fats, and the pathologies are not targeted actually. If we find that what has been mentioned very correctly in the Ayurveda text, and if those pathologies are targeted very nicely, then definitely we can bring the society very nicely out of these metabolic disorders. I think it's very unfortunate that apart from proper dietary advice and apart from proper lifestyle advices, moreover, people are medicine oriented than lifestyle oriented and diet oriented. And that is the biggest mistake what we are doing, what I feel. Similarly, in diabetes, moreover, the society is gluco-oriented rather than insulino-orientation. Whatever Ayurveda says about metabolic disorders, indirectly, it is all about insulin resistance. It is all about insulin resistance. Diabetes is also about hyperinsulinemia or insulin resistance. But unfortunately, we are targeting only glucose levels where insulin resistance is never targeted at a very large level. So these things are to be targeted, these things are to be pointed out, these things are to be addressed very correctly, and then only we can treat such type of metabolic disorders in a very correct manner. So looking to the what we can call as the pathophysiology which has been mentioned in Ayurveda and the complications which has been mentioned in Ayurveda, that they have said that what are the causes of not only obesity but all the metabolic disorder, that atistholyam ati sampurnat madhur शीत स्निग्ध उपयोगात अव्यायामात दिवा स्वप्नात हर्ष नित्यत्वात अचिंतनात द्विज स्वभावात उपजायते. These are the reasons what they have mentioned. Ati sampurnat, you are every time full. Ayurveda has not told about full meals. They have to every time told the half the capacity of the abdomen. And this is the basic root, what I'll tell you. None of the people, none of the physicians also tell the diabetic patient, don't eat full the stomach. People eat full stomach. Only what are the restrictions? Don't eat sweets. But that is not sufficient. If you see that, Ati Sampurnat, Guru, Madhura, Sheet, Snigdha Upayogat. So these are not addressed very correctly in meta. These are to be things which are to be addressed very correctly in metabolic disorders. And this Guru, Madhura, Sheet, Snigdha Upayogat, this is to be elaborated very correctly. People know that Snigdha Upayogat, people do a big mistake that they stop with saturated fats and they move to polyunsaturated fatty acids, which are more dangerous, which can create insulin resistance in obesity, as well as diabetes, as well as in metabolic disorders, because they have very high level of omega-6 fatty acids. But in the previous days, whatever the research has happened, that has brought to the surface that polyunsaturated fatty acids are more better than saturated fatty acids, now which is proving wrong. So this Ati Stholyad, Ati Sampurnad, Ati Guru, Ati Madhura, Ati Shita means excessive oily things, excessive things which are heavy for digestion, more cold things which are cold in nature, and more things which are sweet in nature. All these things are to be controlled. We'll look into it one by one. But these four things are very, very important. And the selection of means what we are doing, we are eating refined carbs. We are also consuming refined fats. And consumption of refined fats, you see, refined oils, whatever you consume, these are refined seed oils. And these refined seed oils, already they are solvent extracted, already their peroxide values are beyond the limits. And apart from that, they have a very high amount of omega-6 fatty acids, which can prove very inflammatory. So the impact of this food is to be seen that
Hello, hello.
सर तुमच्या आवाजामध्ये डिस्टर्बन्स आहे, थोडा आवाज येत नाहीये, चेक करा जरा. डॉक्टर सबनीस सरांच्या एंडला काही टेक्निकल प्रॉब्लेम आलाय. जरा 2 मिनिटं वाट बघूयात. जॉईन करतील ते. जोपर्यंत सर लॉग इन करतील तोपर्यंत एक छोटी माहिती मी तुम्हाला देतो की आपलं उद्याचं जे सेशन आहे ते याच वेळेवर होणार आहे. परंतु परवा दिवशी आपलं जे सेशन होतं तो सेशन हमने डे बिफोर टुमारो रखा है, दैट इज ऑन 8th of June. So we need to shift that particular session on Tuesday, that is 11th of June. As on 8th, we are having one conference, MARDCON. We are going to telecast that conference at that particular time, what schedule we have reserved. So you will able to see that conference on 8th, on that particular time slot. But you have to join that particular MARDCON conference by YouTube channel only, not by the particular and that particular YouTube channel link I will share you again. And that particular lecture that we have scheduled on 8th, that will be delivered on 11th. Because on 10th we are having University Foundation Day. So whole day there will be celebrations and event in the university premises. So we will have that e-session on 11th. Dr. Harish Patankar sir's Kesh Ayurved, that particular lecture will be broadcasted on 11th of June, not on 8th. So kindly note about the same change. Sir will resume his lecture very soon. Please be patient. I think due to some technical glitch.
Yeah. We have joined now.
Yes, sir. Please, sir, continue.
Yeah. So, though it is an anabolic disorder, so when there is an excessive anabolism, Ayurveda clearly tells that there is certain catabolism also, and they have mentioned it that Meta eva upichyate na tathe itare dhatavaha. So when there is an excessive nourishment of adipose tissues, other tissues are not nourished. And that is a quotation from Ayurveda. So when excessive anabolism takes place, there are somewhere in the body catabolism also takes place, and that is a very, very important concept. And again they say that Shaithilyat so kumaryat gurutvacha medaso java uparadha. Shaithilya is very important, and that is never targeted, and that should be targeted. So we have to see that what do you mean by Shaithilya? So what is this Shaithilya? That is dampening of the tissues, laxity in the tissues, non-working of the cell of the tissues. That is actually Shaithilya, that ATP is not getting generated at a cell level. And that is clear, that should be targeted very nicely. And then they say that they mentioned about the more complications that Medasa Shleshma Sansargat means. Again, they clearly mentioned that obesity is not only the disease of adipose tissues, but it is also a disease of muscles. And that is a very, very important concept, what I have to underline today, because we only target adipose tissues. But only targeting adipose tissues will not serve the purpose of any metabolic disorders like obesity, diabetes, polycystic ovarian disease. But muscles are also be targeted, and this reference has been given in Charak also. So the pathophysiology they have mentioned that Medasavritta Margatvat Vayu Koshte Visheshtah Charana Sanduksham Agnim Aharam Shoshetapi Tasmat Sashighram Jaret Aharam Cha Atikangshati Vikarashrute Goran Kangshitat Kala Vyatikramat. So Kala Vyatikramat is very, very important. That is untimely eating. They have said untimely eating is very important, because when you are eating at night, when there is no eating window at all, when your biological clocks in the hypothalamus, they are closed, when the oscillating clocks in the hepatocytes, they are closed, they are not working due to the drop in the cortisol and rise in melanocortin hormones. At that time, if you are eating, that can land to severe indigestion. So Kalati Vitikramat is very important in metabolic disorders. And specifically when it comes to obesity, Medasa Avritta Margatuvat Vayu Koshthe Visheshtaha. So there is an obstruction. What they say that Medasa Avritta, in the obstruction in the channels of Vata dosha, and that obstruction in the channel of Vata dosha, in specifically in abdomen, can initiate or can aggravate the appetite. This is very, very important. That Charana Sanduksham Agnim Aharam Shoshayatapi. That increase in appetite is seen in metabolic disorders, in diabetes, in obesity. And this increase in appetite is merely due to the toxic hunger that is due to insulin resistance. It's very clear. Unless and until you are reducing, this one word can tell the insulin resistance at a limbic area of the brain. Because at the limbic area of the brain, if there is insulin resistance, the brain can't see leptin. And when the brain can't see leptin, your appetite control system gets disturbed and you feel more hungry and hungry. So what we have to do here, we have to reduce the insulin resistance at the limbic area of the brain. Multiple tissues are affected with insulin. Because of majority of the tissues, there are only few tissues which are not having insulin receptors, but majority of the tissues, they will have an insulin resistance. Similarly, the limbic area also have an insulin resistance, and then leptin resistance also occurs, and that's why there is an increase in appetite. So we have to see, and the last line, if you can see that, Medo Maunsata Ativruddhatvat Chalaspika Gudarastanaha. Ayathopachotsao naro atisthula uchyate. It is an excessive growth of muscles. Medo mamsa ativruddhatvat. And when we say that it is an excessive, there is no hypertrophy of the muscles. Sorry, there is no hyperplasty of the muscles. Muscles are grown because of the visceral, because of the infiltration of fats into the muscles. And that's why we say that it is not only the disease of fat, it is also a disease of muscles, where fats has been infiltrated into the muscles, and that fat are never targeted. What we target is the visceral fats, which are about in the viscera, maybe in the pancreas, maybe into the liver, maybe into the ovaries. But these fats which are infiltrated into the muscles, they create a biggest pathology, because these infiltrated fats create lot of insulin resistance, and muscle is the very biggest tissue which has maximum amount of insulin receptors on the body. And that's why it's very important. So again, when they come to the management, they clearly mentioned that they have mentioned that this very important sutra that Vatagnapanani Sleshma Medo Haranicha. So they have decided, they have mentioned about the dietary regimes, Vatagnana Panani Sleshma Medo Harani. The food which can pacify Vata dosh, the food which can pacify Sleshma, that is Kapha dosh, and the food which can specify or bring down the medo dhatu, all such type of food which is very rough, that is Guksha, Ushna, Bastya, Stikshna, Rukshna, Udavartananicha. And I have mentioned many drugs. So the mode of action of these drugs we have identified, but they are having a varied mode of action. And again, they have mentioned that Bhojanartha Prayojani Panam cha Anumadhudakam. Now it's very important. That is the big question among all the researchers, among all the Ayurvedic physicians, that when honey is indicated in metabolic disorders, at what cost we have? Because honey is full of fructose and glucose, which is mainly fructose. And we can't give more fructose to the people when they are having more upper glycemic status or in obesity. So here they have clearly mentioned that माक्षिकस्येति मधुना न मधुना वृक्षप्रयोगेषु दुष्टत्वात् बृहत्वत्वाच्यं यतो योगवाही मधु यदा वृश्चिने युज्यते तदा वृश्यत्वं करुणी लेखनयुक्तं तु लेखनकरम्. You have to use madhu not as a main drug, but you have to use madhu because of its yogavahi activity. You have to use madhu along with the lekhan food or along with the lekhan medicine as a anupan only. And that too, it is in the certain conditions. These conditions, it will take a very long period to explore what conditions it is of the body where honey can be given to the people. Where there is no fat toxicity, there is no ectopic fat deposited, where the triglyceride levels are very low, where the cholesterol levels are high, where the LDL levels are high, but insulin levels are low. In short, honey can be given in those. It's very important. What we do, we go by lipid profiles. Unfortunately, we don't see inflammation. Unfortunately, we don't study insulin. We don't study HOMA index. And we go by lipid profile where we can't interpret it without insulin and HSCR. Without inflammation and insulin resistance, we can't interpret lipid profiles very correctly. And here, if we want to advise such type of food like honey to the people, we should know lipid profile very nicely along with insulin, serum insulin, and along with HOMA index and along with high sensitive CRP. These are the very important things. So again, coming to the diabetic reasons, what they have mentioned in Ayurveda regarding diabetes, that asya sukham swapna sukham dadhini. Now, this is very important. Asya sukham means sedentary lifestyle, excessive sleep. Now, the big question among the nutritionists and the objection of the nutrition in Ayurveda is that dadhini, why curd? Curd, Gramya Udaka Anuparasan Payansi, milk, the soups of the meat, all these are the causes of diabetes, where it doesn't have any glucose, it doesn't have any carbs. Okay, we can understand about milk, but curds doesn't have carbs. Meat, soups doesn't have carbs. Then why these are the causes of diabetes mentioned in Ayurveda? That is a big question. And then Navannapanam, which is least focused, that freshly harvested grains, Navannapanam. Gudavai Krutancha, we can understand that the recipes which are coming out of jaggery and sugar. These are the causes of diabetes or prameha. What prameha is a little bit different than diabetes mellitus, but still we can consider it as diabetes mellitus. And these are some of the reasons of diabetes mellitus. The big question is about the meat soups, regarding milk and regarding curds. There are some studies which are not peer reviewed, but there are some studies, and what we are observing in our clinics also with our patients with a huge data, that consumption of curds in a regular fashion, first of all, changes the gut flora. And now the question is that the curd is supposed to be not curd, yogurt. There is a difference between a yogurt and curd. Yogurt is supposed to have a good impact on the gut flora, but curd, and what curd, how we are curdling it, it depends on that what bacteria are involved into it. And regular consumption of curds have shown to increase the high sensitive CRP levels in some of the patients. So it is a cause of inflammation up to some level, what we are observing in our clinics. And our observations are no doubt important because they are well documented and it's a huge data of thousands of patients. Then secondly is a Gramyodaka Anuparasan Payansi. Payan milk is again the biggest culprit, which has a lactose, which is again a sugar, which is again has been proved inflammatory in certain conditions. I am not talking very broadly that it is inflammatory, but it depends on your insulin resistance at a liver. It depends on the insulin resistance at a what we can call skeletal muscles, and it depends on the insulin glucagon ratio, whether it will be inflammatory to that person or not. Now, so in such a depth, we have to study what is the insulin to glucagon ratio and what is purely insulin resistance to the hepatocyte. And many a times in metabolic disorder, there is a strong insulin resistance at a hepatocyte level. And then in such conditions, no meat soups, no curds, no milk and milk products are allowed, which should be underlined and which should be advised to the patient that these substances are not to be consumed. Navannapanam, yes, they are very heavy to get digested. All the newly freshly harvested grains are very, very heavy to get digested because of the presence of certain phytochemicals, which normally after some time period get diminished into it. So this is very important concept that these diet controls are to be advised to the patient. Then again, they have classified the patients of diabetes into four types. Stula pramehi, obese diabetics. Balarva ne kaha, very strong diabetics. Prushyastita kaha paridurbalasya, with the very thin diabetics and very weak diabetes. Now we have to focus again when we are in the Asian countries. We are thinking about Asian countries. We classify obesity, we classify metabolic disorders as per the obese people and the toffee people. What are these toffee people? TOFI toffee. These toffee people are thin outside and fat inside. This is what we can call as a Prushyastatikaha Paridurbalasya, where these people, they are having, though they are thin, they are having very strong insulin resistance at a adipocyte level. These people, they don't have a hypertrophy of fats, but if their fat cells are highly inflamed, their fat cells are insulin resistant, and their GLP, glucagon-like peptide 1 level from the abdomen that is deranged, and that's why they have a more and more insulin resistance, and they are more risky. They have high triglycerides, they have high cholesterol, they have low LDL, and they have high insulin. So such type of picture, when you have such type of picture, they are again prone for metabolic disorders. And we go by the size of the person. Oh, that person is very thin. He or she can't have diabetes, or he or she can't have metabolic syndrome. But these people are more risky people than other obese people. So this classification is very important, whether you are obese, whether you are toffee, that is thin outside and fat inside. Again, how much resistance, insulin resistance you have, how much adiponectin levels you have, how much HSCR inflammation you have, all these parameters will suggest the mode of the management part of these people. Now, when we say that broadly speaking, it is hyperglycemia, it is overweight, BMI is on the higher side. So looking to these very broader, what we can say that parameters, we have to peep into the very parameters which are dealing with at a molecular level, at a cellular level. And these parameters are very important. So these are the same things. So the fat cell is more than a bag of fat. So what happens that these fat cells, when we say that Balavan kaha paridurbalishya, when we say that on what part it depends, because fat adipose cell itself is a very expandable cell. It has a huge capacity to expand, and it can expand up to 200 times. It can expand up to 200 times. And although the fat cell has been referred to simply as a single ring cell with a thin layer of cytoplasm surrounding a large fat droplet, this thin layer of cytoplasm is actually a high complex endocrine, inflammatory, and metabolic tissue. It is inflammatory as well as metabolic tissue. Why it is inflammatory? Because what happens when the droplet of fat expands, the mitochondria, the nucleus, the endoplasmic reticulum, they are pushed apart near the cell wall and they get congestion. This congestion releases cytokines, interleukins, and the inflammatory markers. That's very important. Apart from that, why it is endocrine? Because there are certain important hormones which are secreted by adipose tissues. And one of the important hormone is adiponectin, which is actually an anti-inflammatory hormone. And second is leptin, which decides about the appetite of the person. So if the leptin is good, if the brain is sensing leptin very nicely, if the limbic area is sensing leptin very nicely, then the appetite, the satiety is there with the patients. But when the leptin is high, on the higher side, or there is a leptin resistance at a limbic level, then satiety is not under control. You are eating 2 laddus or 8 laddus or 10 laddus, you don't know. You go to the party, you eat 10 gulab jamuns, you don't know. Because there is no satiety with you. And this satiety is due to the leptin resistance, and that's why it is called as a endocrine tissue, endocrine cell, inflammatory cell, and metabolic, because it creates more insulin resistance to different cells. It creates congestion. Here the monocytes get due to congestion, the monocytes get converted to macrophages, and then there is a necrosis, and this necrosis again can create more inflammation. That's why it is related with metabolism, it is related with inflammation, it is related with the endocrine hormones. So such an important one thing everybody should remember, that the health of the person, completely fat cells and the muscle cells decides the health of the person. These are very, very important tissues of the body. And if there is a normalcy between these tissues, definitely we can maintain a normal health. So it regulates the storage and breakdown of fat, communicates with the central nervous system through leptin and through gut. Even gut also is a communication with the appetite control system through cholecystokinin and neuropeptide Y. These are the gut hormones. And that's how they are connected with the hypothalamus to control the appetite. So these are all important things. Then coming to the inflammation part, the systemic inflammation associated with obesity and other metabolic disorders may be pathogenesis of heart disease, diabetes, neurodegenerative disease, and common form of cancers. So low-grade inflammation is again a very important part in obesity and metabolic disorders. Unfortunately, I'm saying it's very, very unfortunate that we never focus on the low-grade inflammation. It's just the reason because we don't have good medication to focus on low-grade inflammation. If there would be certain medicine which would have controlled on the inflammation, every physician would have tested HSCRP for the patient. Because there are good hypoglycemic drugs, we are checking fasting post-meal sugar and we are checking HbA1c, and we are focusing on the glucose, but not on the inflammation. So this inflammation is to be studied very nicely, and we have to try a lot to bring down this inflammation. And this inflammation is one of the important cause of insulin resistance. There are mainly 3 reasons of insulin resistance. One is stress. Maybe physical stress, maybe dietary stress, maybe mental stress. Any stress can cause insulin resistance because of the secretion of glucocorticoids, that is cortisol, and epinephrine, that is adrenaline. Second reason of insulin resistance is inflammation. And the causes of inflammation we have to identify very correctly. And the third reason is sleep deprivation. Sleep deprivation is the most important cause of insulin resistance, which is again never targeted very nicely in the lifestyle. In lifestyle, we see that you exercise a lot. But advice is that you sleep properly. You should have a deep sleep. And in a proper time, not sleeping at 1 o'clock and waking up at 8 o'clock. But sleeping at least 9 to 10 o'clock and waking up at 4 to 5 o'clock. So that corrects the circadian rhythm, and that can bring the insulin resistance down, that can bring inflammation down. So these are the 3 important factors what we have to see. Then when we talk about metabolic disorders, these metabolic disorders, and mainly insulin resistance and inflammation, they target majority of the tissues, right of creating polycystic ovarian disease, creating coronary artery disease, creating erectile dysfunction, creating migraines, creating obesity, creating diabetes mellitus. So all this big mellow. And the main reason is that insulin resistance. And where is the insulin resistance? insulin resistance at a cardiac cell, cardiac muscles, at a skeletal muscles, at a hepatocytes, at a ovarian tissues, creating polycystic ovarian disease, and at a hypothalamus level, creating change in the appetite control system. So this is the basic pathophysiology. Inflammation is the basic pathophysiology. Insulin resistance is the basic pathophysiology, and derangements in appetite control system, derangement in the gut flora, inflammation at the adipocyte level, and most important, that is oxidative stress. When we talk about oxidative stress in metabolic disorders, we write antioxidant tablets and we are free. We don't consider really whether the endogenous antioxidant levels, that is SOD, GPX, and CAT, they are increasing or not. It's very unfortunate that we can't check the antioxidant levels in vivo every time. We have to go with the ORAC methods or the DPPH methods to go for the antioxidant activities. But if we check the antioxidant activity in vivo in the terms of vitamin E, CQ10, unicobinone, so if you check these antioxidant level, we will be able to see that, okay, the antioxidant levels are down. We have to do something. And whatever that something we are doing, not through the medication, but by the appropriate diet and by an appropriate lifestyle. This can increase the endogenous antioxidant and stop the further damage at a cellular level, reduce insulin sensitivity resistance, increase insulin sensitivity, reduce inflammation, and then correct all the appetite control system and inflammation at a different tissue level. So these are very important things. So what we see as per modern medicine and what we see as per Ayurveda are two different visions, which I have put it on this slide. So we have to see the antioxidant effect, what we are going to check. We have to see the anti-inflammatory effect. We have to focus on mitochondrial dysfunction, which is the basic pathology of all the metabolic disorders. And we never try to regenerate the mitochondria very correctly. We never target on the mitochondrial dysfunction or mitochondrial better function again. So we have to target again insulin sensitivity. We have to target on the effects on the comorbidities of obesity and metabolic disorders. We have to target the appetite control system. So the markers of these disorders are not lipid profile or fasting post-meal sugar or HbA1c. They should not be the markers, at least when we are in research part or when we are studying combinedly or integratively, because we are in integration in MUHS. Because through Ayurveda, what we are looking into, we don't have any concern of mitochondrial dysfunction, but we have a concern of Agni. That to Jatharagni, Bhutagni, and Dhatuvagnis. These are to be addressed very correctly, and that first we have to identify what we mean by Agni, what we mean by Bhutagnis, what we mean by Dhatuvagnis. That we have to identify very correctly. We have to see the Dhatus, because in metabolic disorders, there is shaithilya, there is laxity, there is maligness in all the tissues. And that has been mentioned in the texts very clearly. So dhatus are to be targeted, and only we target either cholesterol, or we are targeting only HbA1c, or only sugar. Just we are treating the epitope. We are not treating the underlying pathology. We are not treating managing inflammation at all. We are not managing mitochondrial dysfunction at all. Leave it, we are not managing even insulin at all. We are managing sugars. Managing sugar does not mean that you are managing insulin, because management of insulin is totally different than management of sugar. Giving hypoglycemic drugs will not manage insulin. Make it a point. There is only one drug, that is metformin, which can increase the sensitivity of insulin and reduce the hepatic glucose output. But other drugs, sulfonylureas, they are stimulating insulin. That can create insulin resistance or hyperinsulinemia. Both are the problems in metabolic disorders, in diabetes specifically. So only lowering cholesterol or lowering sugar levels or lowering only weight in obesity is not the management of such type of disorders. So dhatu portion, correct nourishment of the tissues is very important. Correct nourishment of the tissues, correct what we can call as normalization of the Dhatu Agnis and Bhuta Agnis are the very, very important part in Ayurveda management. When it comes to modern management, insulin sensitivity, reduction of inflammation, appetite control system, gut flora corrections. Okay, all these are the parameters what we see by both the sides. Then we have to combine the things very correctly and go for the further managements. That is, we have to select the inflammatory markers, maybe interleukins, maybe CRP or HSCRP, lipids, correct interpretation of the lipids. Now, up till now, the trend was that lower LDL, lower cholesterol, and no attention towards insulin. So that was a wrong thing. Now the things are getting corrected. That LDL, unoxidized LDL, I'm very specific and I'm very clear. Unoxidized LDL is not an issue to the humans. When it gets oxidized, then it will create more foam cells and it will create atherosclerotic changes and more plaque formation into the coronaries. But
So
if it
this,
is not oxidized, when the HSCRP levels are low, when the insulin sensitivity is low, when triglycerides are low, HDL is up, LDL is up, cholesterol is up, that is a good picture. So that should be seen, viewed in such a vision. Then glycation should be under control, no doubt. Then there are certain medications which can downregulate the genetic expressions. For example, Amalki, it has been studied that way. There are research papers that Amalki can downregulate it. So certain medications which can downregulate the genetic expression, so lifestyle also downregulates the genetic expressions. So, and then cholecystokinin and insulin-like growth factors, there are many hormones are there. Those should be the actually biomarkers. When it
sir,
comes to
please,
research,
sir,
when
after 2 minutes, we need to move to the next session. Na? We need to sum up the
I
session.
have to stop here, sir.
No, how much time remaining, sir? किती वेळ बाकी आहे सर आणखी? किती
जरा
स्लाइड्स बाकी
20 मिनिटं लागतील. 20 minutes. It will take 20 minutes.
काय आपला टायमिंग जो दिलाय ना, कारण त्यांचे पुढचे जे सेशन आहेत सर्वांचे ते टायमिंग नुसार आहेत. आपण 2:30 ते 2:15 असा वेळ दिलेला होता. थोडं इंटरप्शन झालं
किती वेळ
तुमचं. एक 5 मिनिटं
किती
तुम्ही
वेळात
घ्या.
संपवू?
एक 5
5
मिनिटं
मिनिटात संपवतो. 5 मिनिटात संपवतो, सर.
ऍक्टिव्हिटीज आहेत तिथे जरा जावं लागेल ना,
Okay, I'll finish it in 5 minutes.
प्लीज.
So not going into much detail of the things, I want to express 2-3 things very importantly. That Sharira Shaithilyat is to be targeted. And for Sharira Shaithilyat, there is one concept, that is a clay the formation. Clay the formation is to be is to be addressed very nicely. And this clay the formation can create lot of laxity into the tissues. It can create what we can call as more inflammation into the tissues at a cell level, and that can create more pathogenesis into the tissues. So that is to be targeted. The another most important thing, and the last slide, I think this will be the second last slide, that there is one word that is called as Lasika and Vasa, which has come into Ayurveda, which are never targeted, which are most important part. And this Vasa is the intramyocellular fats. And all the health of the obese people, of the metabolic disorder people, depends on the health of the intramyocellular fats. These intramyocellular fats, if the muscles are insulin resistance, these, when the what fatty acids they enter into the tissues, these fatty acids, they will not again come as a triacylglycerols, but they will create diacylglycerols and they will create ceramides. And these ceramides will damage the mitochondria of the muscles, and then they will create more fatty muscles, more ectopic fats into the tissues. And these ectopic fats will damage the mitochondria. And that is what is actually Shaithilya at a muscular level. That is actually what we can call as insulin resistance at a muscular level as well as adipose tissue level, and that can create lot of damage to smooth muscles, that can create lot of damage to the arteries, that can create erectile dysfunction, that can create what we can call as insufficiencies to the organs. And the main problem is the intramuscular fat, and we have to give the management which can reduce the ceramides, which can reduce the which can improve the health of the intramyocellular fat, which can improve the blood-4 receptors. So all such managements, which solely depends on your very proper diet, and that diet which is low in inflammation, which is low in ages, which is low in rages, and that diet which is devoid of excessive sugar, excessive fructose, and seed oils, that is oils which are rich in omega-6, along with safflower oil, which is a highly demand in the cardiac disorders, that is worst for heart. Safflower oil, that is curry oil. Then all many of the oils are there which have very high amount of omega-6. Fructose, which is highly inflammatory, which can create more ages, which will not increase sugar. We are not dealing with sugar. We have to deal with the ages into the body, and those ages can be increased by the fructose and polyol pathways. So all these are to be controlled very nicely. And when we are controlling such a basic pathologies, definitely we can have a very good control on the metabolic disorders in the body. So I stop here. Thank you. Thank you very much.
Thank you very much, sir. I first of all congratulate you, sir, for giving such a splendid information on a much needed topic, that is obesity management. We are very much thankful to you. Secondly, I request all the SIP students, those who have joined through their personal mobile, to put on their video. Also, I request today's speaker, Sabnis sir, also to put on his video. Sir, तुमचा व्हिडिओ ऑफच आहे.
का व्हिडिओ बरं ठीक आहे. नाही ऑन आहे सर माझा व्हिडिओ.
नाही ना सर.
स्क्रीन बी शेअर करतो मी.
नाही, स्क्रीन जरी असली तरी तो पीसीचा जो कॅमेरा आहे ना, तो कदाचित स्लॉट मध्ये असेल. कॅमेराला एका
तिकडनं ते चालू I think now it is on.
just hold a second. नाही आहे सर, अजून ऑन नाही आहे. तो व्हिडिओ ऑन नाही आहे सर.
माझ्याकडनं तर ऑन आहे सर, काही प्रॉब्लेम नाही.
Can anyone from the student side, are you able to see?
Yes, sir. Yes, sir.
Not to the particular PPT, but about Mukund Sabnis sir's video.
No, sir. No.
That is what I want to.
Okay, but from my side it's on. I can't.
कॅमेराचा स्लॉट असेल ना सर, त्याला स्लीट आहे, ती स्लीट ऑन ऑफ करा.
Okay.
म्हणजे मुलांना दिसावं आम्ही कोणाचं लेक्चर.
अरे ठीक आहे, एकच मिनिटात करतो सर. आता दिसतंय सर?
नाही सर.
ठीक आहे, इट्स ओके.
मोबाईलवर ऑन करा ना सर. मोबाईल लिंक करतो.
हा, मोबाईलवर ना.
इमिजिएट ऑन करा मोबाईल. प्रतिभा मॅडम, स्क्रीनशॉट घेऊन घ्या स्क्रीनचा.
Yes, sir. Yes.
आणि ते सबमिट करा अटेंडन्स लाईनच्या सगळ्यांची. पुन्हा एकदा मी तुम्हाला सगळ्यांना सांगतो कि जो हमारा ये सेशन जो कल का सेशन है वो हमारा टाइम पे होने वाला है, जिस टाइम पे हमने शेड्यूल किया है, दैट इज फ्राइडे. बट ऑन सैटरडेज, रिगार्डिंग सैटरडेज ई सेशन, दैट इज ऑफ डॉक्टर हरीश पाटनकर सर, केशा आयुर्वेद, पुणे. We have rescheduled that e-session, and that session will be held on 12th of June. So on 9th of June, you will watch the MARDCON conference through.
सर आता दिसतंय का?
त्या त्याच्यात जॉईन झालं तर वेगळ्याने जॉईन झालं सर तुम्ही.
मोबाईलवर
काय नावाने आहे सर ते लॉग इन आता?
now can you see?
Yes. आता दिसतंय सर तुमचा व्हिडिओ.
Yes. So thank you very much to all.
खूप खूप आभार सर. आपण आपला अमूल्य वेळ काढून एसआयपीच्या मुलांसाठी आज ओबेसिटी या महत्वाच्या विषयावरती लेक्चर ठेवलं. पुढच्या वेळेला एक संबंध आपण एक वर्कशॉप वगैरे घेणार आहोत सर फिजिकल. त्यावेळेला आपण सर्व आपल्या जेवढे व्हर्टिकल हेड्स आहेत लर्निंग गोल्सचे त्यांना विद्यापीठात बोलवणार आहोत. शेड्यूल कसा असावा आणि काही गोष्टी त्याच्यामध्ये या विषयावर पण आपण एक चर्चासत्र ठेवूयात.
Thank you.
तर तुम्हा सर्वांचे पुन्हा एकदा धन्यवाद. सर्व विद्यार्थी देखील मोठ्या संख्येने जॉईन झाले त्या सर्वांचे आभार. सर्व एसआयपी सेंटरचे सुद्धा खूप खूप धन्यवाद.
Thank you, sir. Thank you, sir.